epidermis before we get into the next layer, the dermis. The epidermis was composed of the stratum basale, where we had actively dividing cells. There were melanocytes there, skin stem cells. Above those, we go to the stratum spinosum, where the keratinocytes are being tied together by desmosomes. Above that is the stratum granulosum. Flattened cells, the organelles are deteriorating. They're becoming more like mature or dead skin cells we'd find on the top. Now, if this was thick skin, we'd have another layer, the stratum lucidum. We do not in this micrograph. We go right to the stratum corneum, as we do with most skin, and that is 20 to 30 layers of dead cells, flattened cells filled with keratin, providing what we see when we look at someone's skin. Let's talk now about what's below the epidermis, and that would be the dermis, which is a very strong, flexible connective tissue. Within that tissue, we're going to find individual cells like fibroblasts, macrophages, mast cells, and many white blood cells. Fibers here are going to be bound together. They make up what is known as leather. If you have leather, you have a hide. It's a preserved dermis. There are also nerves, blood vessels, and lymphatic vessels. In fact, the stratum basale gets all its nutrients from blood vessels within this layer. There are hair follicles. When we get to skin appendages, oil glands, and sweat glands as well. So the epidermis was divided into 4 or 5 layers, depending on whether it was thick or thin skin. The dermis is going to be divided into 2 layers, a papillary layer and a reticular layer. So up here we have epidermis. This is the lower layers of the epidermis. And then we have the upper part, the papillary layer. And notice these little indentations that almost look like the wings of a butterfly. That's where the name papillary comes from. And below here, the reticular dermis. So that papillary layer is a superficial layer. It's areolar connective tissue with loose interlacing collagen and elastic fibers and blood vessels. Those loose fibers allow phagocytes like macrophages, mast cells, neutrophils to go in, patrol for microorganisms that may have gotten past the upper layers of the skin. And they also form, those little indentations are called dermal papillae, and they send finger-like projections up to the epidermis, touching the epidermis and kind of enveloping the epidermis, and they contain the capillary loops, free nerve endings, and touch receptors. Those capillary loops provide nutrients to the bottom layers of the epidermis. The nerve endings are used to detect things like heat, and those touch receptors are also called tactile corpuscles. They're similar to the other corpuscles we saw, and these are formally referred to as Meissner's corpuscles. So in thick skin, that dermal papillae is on top of the dermal ridges, and those give us epidermal ridges, and the epidermal ridges are called friction ridges, which they work to enhance our ability to grip. They contribute to our sense of touch, and they contain sweat pores. And that sweat pores mean that when you touch something, you leave behind a pattern of these friction ridges, epidermal ridges, which are an extension of the dermal ridges, and those are known as fingerprints more commonly. They are unique to every individual, so we see there are friction ridges here that help us grip things, and in those friction ridges are sweat pores, so when the sweat comes out, that leaves a telltale sign behind. The reticular layer below that is about 80% of the dermal thickness. It's got a more coarse, dense, fibrous connective tissue, lots of elastic fibers providing stretch and recoil properties, collagen fibers that give us strength and resiliency. Collagen also binds water, so it helps to keep skin hydrated. There is the cutaneous plexus, which is a network of blood vessels between the reticular layer and the hypodermis. Remember, the Epidermis is the connective tissue that's not really part of the skin, just below the dermis. And the extracellular matrix will also have a lot of pockets of adipose or fat cells. There are, in addition to those ridges, what are known as cleavage lines or tension lines in the reticular layer that are caused by the fact that collagen fibers run parallel to the skin surface. Now, we can't see these cleavage lines or tension lines, but we know they're there, and they are important to surgeons because if you make an incision parallel to the cleavage line, it will heal much quicker and with less scarring. So if you want to make a cut here, for example, you would not just go straight across, you would do it at an angle. And that is important, again, for surgical incisions. Flexure lines, another type of line, are found in the reticular layer, and they are dermal folds at or near our joints, our articulations. So the dermis is tightly secured to deeper structure, and because of skin's inability to slide easily for joint movements, that will cause creases within the dermis. And we can see these on our hands, our wrists, our fingers, the soles of our feet, and on our toes. And these are the kinds of things you might go to a palm reader to figure out how long your lifeline is. But they're really just markings, flexure lines, because we have joints here and because our fingers are moving. Extreme stretching of the skin can cause dermal tears. So these are tears way down in the dermal layer, and that tends to leave silvery white scars called striae. Those striae are also called stretch marks. Another imbalance involving the dermis is the separation of the dermal and the epidermal layers. When those two layers separate, the gap that is formed is filled with fluid, and we call those blisters. So here is someone having photographed their stretch marks or striae. Skin color. Now that we've talked about the layers of the skin color becomes important. Normal skin color, and we'll also talk about some clinically relevant skin colors. So there are three things that contribute to the color of all skin. The first of which is a pigment. It is called melanin. It is the only pigment made by the skin. It is made by those cells called melanocytes. It's an amino acid-based structure. It comes from the amino acid tyrosine. The enzyme that does it is called tyrosinase. It's packaged into melanosomes that are sent to shield the DNA of keratinocytes from ultraviolet light, which could damage their DNA. The more sun, the more need for the protective shield, the more melanin you produce, so we can tan in the summer. In the skin, there are two forms of melanin. One is a reddish yellow, and the other is more brownish black. And normal skin color differences are due to the amount and the form of melanin that is produced. If you happen to have freckles or pigmented moles, they are just places where melanin has accumulated locally. Excessive sun exposure does damage skin. As soon as you start producing melanin, you have already started the damage to the skin. But excessive sun exposure can lead to the elastic fibers clumping, causing the skin to become more leathery looking. Skin is an important part of the immune system, as it is for almost all systems, so immune system can be depressed. DNA alterations can occur. Those are mutations, and some of those mutations could lead to skin cancers. Ultraviolet light destroys folic acid. Folic acid is part of the process of building DNA, and especially dangerous for developing embryos. Maternity vitamins often contain large dose of folic acid. Some drugs do cause photosensitivity, some antibiotics, some antihistamines, and exposure to sun, if you are photosensitive, can lead to skin rashes. The second pigment found in skin is keratin. Carotene is a yellow to orange pigment, and we can see it most often in thick skin, which would be our palms of our hands and soles of our feet. It accumulates in the stratum corneum and the hypodermis. Carotene can be converted to vitamin A. Vitamin A is important for vision as well as health of the epidermis. And the third pigment is not found directly in the epidermis, it's found in the dermis. That's hemoglobin. And hemoglobin has a reddish color, and we can see it easier in Caucasian patients because they tend to have less melanin, so the hemoglobin shows through. So those are the three things that contribute to normal skin color. Now we need to look at some things that are altered in homeostatic imbalances. Cyanosis is a blue skin color caused by low oxygenation of the hemoglobin. When the hemoglobin is poorly oxygenated, it gives a kind of bluish tint to the skin. That can be seen in Caucasians easily. In others, you need to look at the lips and fingernails. Pallor is a blanch or pale color. That can indicate anemia, can indicate low blood pressure. It's also a normal response to fear and anger. Erythemia is a redness. That can be the result of having a fever. It can be the result of high blood pressure, hypertension. It's part of an inflammatory response, and allergies are inflammatory responses caused by known allergens. So that would also give you erythemia. Jaundice is a yellow cast, a yellow color. That would indicate a liver disorder. Bruises are black and blue marks, are ecchymosis or hematomas. They are blood clotted beneath the skin, and as that clot breaks down, it goes through numerous color changes from black to blue to orange. One in particular that you might want to look for clinically is a brown or black necklace bruising. These are hyperpigmented areas in the axilla or around the neck, and that is sometimes an indicator of insulin resistance and, because of that, elevated blood glucose levels. All right, we'll go with appendages in the next section.